Hello guys, welcome back to my channel which is Real Homeopathy, and usually I used to explain gynecological lectures, and today for a change I thought of explaining about psychology. And I have recently seen few cases psychological, and I thought of sharing it with you all. And I just thought how to take cases of this psychology, which is a mental analysis, to give certain hints on that. And weekly of gynecological lectures I'll be uploading videos on Wednesday and Saturday, and I would ask all of you to like, share and subscribe to my channel. And today, as I explain lectures on psychology, firstly I would ask you all to know details on this constitution here and its layers and acute mentals. So, first we will know about the constitution here. I think I'm going to organ on a little bit of thing here. Before going to psychology, we all need to know about this. So, what is constitution here? There are three types here, mainly three main points which are essential in order to understand a constitution. Firstly, there is a constitutional prescribing. Constitutional prescribing. So it refers to selecting the one remedy. Okay, selecting one remedy which covers all the totality of patient symptoms. Covers totality of patient symptoms. So this is a constitutional prescribing, which is both mental and physical symptoms of the patient, in contrast with the local prescribing, based on only a few localized symptoms, so ignoring all other unrelated features of the case, only considering the main symptoms. If you do the totality of those symptoms and give that one remedy, then you can consider it as a constitutional prescribing. Secondly, a constitutional remedy. Second one is a constitutional remedy. It is one which covers totality of a patient's mental and physical characters over a long period of time. Over a long period of time. Okay. So consisting of the totality of mentals and physical symptoms over a long period, excluding the temporary changes. Temporary changes are nothing but the changes that happens to the person's health. There are certain new symptoms which are occurring. So these are the changes which are occurring temporarily. So removing all of that means excluding those temporary symptoms, just considering the constitutional symptoms for a long period of time. Okay, over a long period of time. So it covers a patient's mental and physical characteristics. So next, coming to the third one, some homeopaths use the term constitutional remedy. So constitutional remedy to refer the deepest layers, of person's constitution, which may be partially obscured by more superficial layers. So these are superficial layers. A person's symptoms are here, the ground, but what all the patient will show is superficial symptoms, and what we need to do is we should not just treat the superficial symptoms, but we should dig this thing and we should consider the root cause of the disease. Root cause of the disease. So this is a constitutional remedy. Constitutional remedy is when you consider a thing and when you treat it constitutionally, means when you come over this layer. This is a superficial layer, this is a deep layer. This is unfortunate and misleading use of the term, since one cannot know for sure what remedy types, if any, lie beneath the surface layer here. Until that layer has been adequately treated. Furthermore, the most superficial layer is most apparent one. Usually everyone treats the superficial layer, the patient's symptoms will get suppressed or either palliated, and again the patient will come back with the same symptoms, or he will be somewhat altered in his symptoms. One symptom will get suppressed and other symptom will start appearing. So this is what you treat superficially. When you treat it in a deep layer form, what happens is the root cause of the disease will be eradicated and the patient will be vitally healthy. So this is all about the constitution. The second one is about the layers. The human organism appears to retain a memory of all preceding chronic states of the body and mind. So this memory includes certain inherited traits and a acquired here. So inherited traits means whenever a person has a disease and if he person marries, the disease will be transferred to the next generation. So this will become a inherited disease. Inherited disease is something where it is inherited from a generation. So each stable state of body and mind can be considered a layer of person's constitution. So when it has been superseded by a different stable state, okay, it remains as a cellular memory which can be reactivated in the future. This takes place when the more recent layers have been peeled off by correct homeopathic prescribing. So what happens, there should be a correct homeopathic prescribing and each layer will be peeled off by homeopathic prescribing every time. Okay, it will be removed. It will be usually 3 or 4 layers will be formed. Okay, by homeopathic prescribing you will be removing this layer, you will be removing this layer, you will be removing this layer, and finally the patient will feel healthy. So next I will see there are healthy symptom free. Natramure person will develop chronic sinusitis. So here I can say you Natramure patient develop chronic sinusitis and claustrophobia following a long divorce settlement, which remain until homeopathic help or other deep healing methods are used. So this will remain until there is something deep treatment is given. Until the treatment is given, this sinusitis and claustrophobia will remain as it is chronic. So by means of homeopathy, by means of a constitution of the patient, you have to give a constitutional remedy. Without treatment, the new symptoms may remain until further trauma causes another deterioration in health. This time to say chronic bronchitis and recurrent depression, still within the natramure layer. There is a natramure layer. The patient is already the natramure layer, okay? The patient is already having a sinusitis and claustrophobia. There will be certain aggravation here. Aggravating factors to that patient, any grief or any anxiety may happen, any trauma to his mental state, then it will lead from sinusitis to chronic bronchitis and claustrophobia to depression, which will go further into a deeper form and makes a huge ocean of diseases where it is difficult to treat. So whenever it is of a right time, give a constitutional treatment and end it off. Some people are born with several layers of pathology. Several layers of pathology. Okay. Peoples are born here, which they inherited from their parents. It is inherited from their parents, as I have said you before, inherited from their parents. They will usually continue to express the uppermost layer until the correct homeopathic remedy resolves it, revealing the one underneath. Okay, in the experience, inherited layers of pathology frequently correspond to miasmatic remedies like miasmatic remedies like sorinum, syphilinum, medorinum, and tuberculinum. Okay, so these are the miasmatic remedy when it is inherited kind of patients, this thing condition. So these can be the miasmatic remedies. When these layers have been removed, one often finds non-miasmatic remedy layers underneath. However, it often happens that a person is born with only one constitutional layer, where it be miasmatic or not, and treatment will simply rebalance the vital force within the same layer. So, thus, a person may benefit from occasional doses of the same constitutional remedy throughout his or her life. So, one dose of this can be given to the patient in the entire his or her life in order to eradicate the inherited diseases of their historical diseases which are inherited. So, it might be miasmatic or the patient's condition is non-miasmatic also. If it is miasmatic, then you have to treat it miasmatically with sorinum, syphilinum, medorinum or tuberculinum. If it is not miasmatic conditions, then you can normally just take a case taking of a patient and see the patient's condition, and you can give the non-miasmatic remedy which is of the patient's constitution. Okay, additional layers of pathology may be acquired after birth. This was all about inheritary. Okay, inheritary. Now coming to acquired diseases, what we should do when it is of acquired state. Okay, that was after which was herited from their generation or their parents. Acquired is after birth. It has been acquired by exposure to traumatic influences. Okay, be it psychological, be it a direct physical injury, or be it any infective diseases. For example, a person may develop a medorinum state acquiring gonorrhea, or a natrum sulfur state after a head injury. A relatively common example is the acquisition of a natrum ure state after a shock. It must be remembered, however, that the majority of patients who present in a natrum ure state after a bereavement or shock were already natrum before the event. So this is all about the layers that has been additional layers. So first of all, there is an inherited state from their parents and one more acquired state of the patient's condition here. Already this is acquired as soon as a birth, and this one is in their inherited form. If both layers are there in a patient, then you have to first eradicate this one. And when you see this picture, this natrum patient, natrum will be hidden here. The natrum picture will be hidden by this acquired state. The natrum picture will be hidden. The natrum picture, which is in the deeper form, will be hidden by the acquired any kind of injury, any kind of infection, be it any kind of psychological trauma. Firstly, you have to treat the superficial layer, then come to this. Okay, first by layer, you have to eradicate it. Apart from acute diseases which produce a temporary change in level, change from one layer to another is uncommon, except as a result of homeopathic treatment. It does sometimes happen that a person spontaneously grows out of one constitutional state and into another. This occurs particularly during childhood when someone calcareas and pulsatillas change into other types. Calcarea is especially common in infancy, which means that many calcarea infants will change into different types as they get older. So this calcarea patient, this pulsatilla patient may change into other states whenever they get older. They have occurred this acquired when they were child to this stage, and when they become older they get renewed in their miasmatic stages as well as the drug pictures also, different types. So this is not a pathological change, this is not reversed by correct prescribing. Unless the previous state involved pathology that was not cured but that was suppressed. I would like to write this suppressed in between this by giving any certain medicines and made it suppress. So most toddlers go through a pulsatilla stage between the ages of 1 or 2 and 4. Again, the majority of these pulsatilla children grow into a different adult type at the age of 5 or 6 or 7. Very few remain constitutionally pulsatilla after this age. Very few remain pulsatilla whenever they are old. And this is it all about today's psychological class. I have explained about a constitutional prescribing, which is a remedy here, constitutional totality, which is the second one, and constitutional remedy, which is referring to different deepest layers. And this is all about the layers here, inherited and acquired layers, and how you need to treat. And I just want to thank you for watching my channel, and if any queries or any doubts, please leave it in the comment section below,